I was actually talking about culture-bound phenomena, and I had a professor of psychology say to me that there's no evidence that culture-bound or cultural illness exists. And I actually said to him, my response to him was that you're absolutely correct. And people were quite surprised, and I said, you're absolutely correct in the world in which you live. So you actually can't necessarily blame someone if they've never actually been exposed to it before. So the important point is that if you actually don't have it in a framework that most people, and what I'm talking about is mainstream, can relate to, in that it's actually researched and it's written up in a scientific journal, then they're actually forced to relate to it, or at least open their mindset up to a different reality. You'd actually ask people questions like, have you seen spirits? Have you actually seen things that no one else can see or hear? And Aboriginal people will say yes. And on the test you actually had to mark them down as having a potential psychosis. There are other things too in terms of our grief processes. When someone passes away, as part of our grieving we actually cut ourselves as an expression of grief. It's quite a common thing, we call them sorry cuts. And there was a mental status exam that actually asked the primary question, do you engage in deliberate acts of self-harm? And you can actually be sent into a psychiatric ward on the basis of answering yes to that question alone. Most Aboriginal people would answer yes to that because it's a normal part of our cultural grief. So there were so many examples of those sorts of things that basically people were getting things very wrong, and not actually understanding the culture at all. Language marginalises people. It marginalises Aboriginal people because we don't have access to the flash clinical words. So you can be a really good cultural worker and you can actually know what's going on for your client, but when you go into a clinical world, because you can't speak that language, because you can't articulate it in a way that mainstream will pay attention to, you're quite often dismissed. The other thing is with, if you're a clinician or a non-Indigenous person, you're going into a cultural world, you're also marginalised too because you don't have access to our words and our language, you know what I mean? So the focus of a lot of the work that I do is actually teaching people that dual language. So if you want to go into, and that's why when I train Aboriginal and non-Aboriginal people, I actually use language as a primary focus. So I'll actually explain the clinical term and then I'll explain the cultural term at the same time, so that everyone is actually learning basically a common language and meeting together. Two young girls who, again, Derby, suicide rate one of the highest in the world, and we'd been doing a training in Broome, which is about 2 hours away, and they happened to come along and again said, we're seeing all these things in our communities and with our friends and with our cousins, and we need you to come and talk about this stuff. So they kept pushing the government and eventually got funding, and again we designed 3 different packages, which basically meant that we trained service providers, we trained community people, which is elders and parents and a range of people, and youth. So the packages were actually very different in that the service providers was around how do you work better with Aboriginal people, how do you do counselling better, how do you do suicide intervention better. Community was around how do you recognise these things, what can you do when these things hit, what sorts of coping strategies do you need around effective communication, all those sorts of things. And same with the youth, it was basically psychoeducative. So the packages were unique in that we targeted the whole community. But that's the beauty of going out to communities, is that you can actually see actual change. That's the great thing about it, is you can have a community population 2,000, and the Indigenous population is probably about 30% of that, and we had most of them there. So basically everyone is learning the same things, speaking the same language, and they all know what to do. So initiatives like that are extraordinary, but we had, like I said, 117 people turn up in 6 days. So we did 2 days of service providers, 2 days with community, 2 days with youth, 7 days, and then we had 1 day where we got everyone together and developed an action plan, and then we followed them over 18 months. So it was only 3 phases, but we basically followed them over 18 months to the point that they were actually running the programs themselves. So now we actually deliver those Australia-wide, which are just absolutely fantastic.